Hi there, I'm Dr. Stephen Phelan. Welcome to Dental Excellence. And for today's video, I'd like to share with you a case, a patient's treatment that I've been working on for the last 8 months. And I just completed the case by inserting the upper arch of restorations this week. So I just inserted the upper arch this week. And this case is a full mouth rehabilitation case. And the point of this video is I want to share with you one tip that's made a big difference in the finishing of full mouth rehabilitation cases for me in my dental practice. And when I started out treating these cases 20 years ago, my initial sequence of treating the cases was we would actually finish the entire case, upper and lower arch, all at once and have all the restorations fabricated all at once. And then I'd insert them either in 1 day or 2 days. And, that worked really well. It worked really well. And I think it helped that I had a good system for taking the bite records and the restorative records. And I had excellent ceramists that I worked with on these cases. But to be completely transparent, I don't think the level of precision was quite as good as I would like. Meaning, I'd sometimes spend 20 minutes, 30 minutes fine-tuning the occlusion when I'm inserting the case, just finalizing the contacts and fine-tuning the occlusion. And for me, I felt that that was too much. I felt that that was too much adjusting of the porcelain, more than I'd like to see in the cases. So I kind of developed my protocol and the system that I follow when I'm finishing full mouth cases. And that's the tip that I want to give you today. And what that change to my protocol was that I'd finish the case 1 arch at a time. Sometimes I finish the case anterior first. So say anterior 6 upper, 6 lower, or 8 upper, 8 lower, then the posterior. But for the majority of the cases, I finish it 1 arch at a time. And the cool thing about this is I'm able to test out the finished arch against the provisional restorations in the opposing arch. And when I insert the first arch of finished restorations, any adjustments that are needed at that stage, I make on the plastic, on the opposing provisional restorations. And then I let the patient go for 4 to 6 weeks testing that out to make sure everything's perfect. And so that is something that I think has really made a difference in the precision of my cases. After the testing phase, I take a new series of bite records that we can verify with the SAM3 system. And then I have my ceramist, usually Harold Heindel for these cases, complete the opposing arch of restorations. And I actually taught an update, which I'll share with you in a minute, to my protocol to my occlusion design members. And it's more detailed than what I could do in my dental excellence videos, because I went through a lot of different scenarios and options for taking the bite records, especially when you're taking the bite records of finished arch against lower opposing preparations, whether it be upper or lower finished first. And that's the system that I use for my full mouth cases the last, say, 5 years, 4 to 5 years. And I'll tell you, many of the cases, I've dialed in the occlusion so well at the point where we're cementing or bonding in the second arch of restorations that it's pretty rare for me to spend more than 10 to 12 minutes at finalizing the occlusion. And for this case that I'm sharing with you today, I might have spent 3 to 4 minutes. I wanted to lighten the occlusion a little bit on the implant crowns as opposed to the tooth-supported crowns. Just a little. I wanted to lighten it just a little because of force management, bite force and velocity of bite for this patient, and history of his previous rehabilitation failing and all of the initial implants that he had placed with that rehabilitation actually failing with capsular, like fibrous encapsulation of the implants from, I think, overloading. So I was a little careful with the implant supported crowns, and so I spent a few minutes adjusting those. Other than those, there was nothing to adjust. I usually put the restorations in anterior first, then posterior. When I put in the front 6, I absolutely did nothing to adjust the occlusion of the front 6 tooth supported crowns. It was really cool. So that's a real pleasure when you're doing these cases, if you can finish the rehabilitation and there's hardly anything to adjust. So this is the case. It was a patient with a full mouth rehabilitation. He had a partial rehabilitation that was done about 8 years ago. Again, a number of the implant-supported restorations failed or were failing when he came to see me. And in fact, he actually lost an upper first bicuspid that was tooth-supported as well. But the reconstruction, partial reconstruction, unfortunately did not address changing his guidance. And he has, again, highest bite force and highest amount or fastest velocity of closing of any patient I've seen in almost 20 years. So I needed to address changing the occlusion design. It wasn't really a case where we desperately needed to change the aesthetics. The aesthetics of the old metal ceramic restorations, even though they're only 7 or 8 years, wasn't that great, but it wasn't his primary concern. It was more, I'm breaking things, my occlusion isn't right, I'm grinding like crazy, and I know that I'm breaking back teeth. So they really didn't address the guidance. And so we had, again, the restorations completed. This was this week, the final upper arch. These are images of the final upper arch of restorations. These are all zirconia restorations, layered zirconia in the anterior, and then 2 screw retained implant crowns, Straumann implants. And as I said, I finished the lower arch first. This picture is of the lower arch finished, and the upper arch in provisionals that he tested out again for, in his case, I think it was about 8 weeks before we had him come back, take off the provisional restorations, take the new final impression of the upper arch, and take the bite records that I would like to use to have Harold then build the upper arch of porcelain restorations. And here's before and after finished. Again, this was immediately post-treatment. I inserted these this week, so you can see the tissue's been, I've gone around and made sure I removed all of the resin cement from all of the restorations because I don't want any overhanging cement. So the tissue's a little damaged, slightly damaged from all of the restorative fine finishing of the restorations. For the most part, I used a 12B blade to remove the resin cement. I don't really use rotary instruments around cervical marginal porcelain. But you can see the new occlusion design. The biggest thing that I changed was the guidance. You can't really get a good feel for that from this image, but I'll show you another image. And improve the aesthetics as well, obviously. And here's an image that really shows the change in the guidance design. And this was very successful with the provisional restorations. Very successful with the provisional restorations. This is a case I went into detailed teaching during a couple of my monthly occlusion design members webinars, just to get to the point where I was, taking the upper records to finish the upper restorations. Now I'm going to kind of go through with the entire case presentation of the case once I have some post-operative photos in a month or so. So either maybe August or September's members webinar, I'm going to share this case in detail, kind of a whole summary, because it's a great case as far as force management issues that I resolved with a change in the occlusion design. And he's doing much better with this new occlusion design. And the other thing that I did was during a monthly coaching webinar with my occlusion design members, I went through this entire new protocol that I've developed for precision restorative records. I even gave them a 10-step checklist that they could follow to take all of the records with this new protocol. And it's been very successful. And even in May of 2016, I had an additional webinar about bite records where I showed a number of different techniques to take bite records on full arch and full mouth cases under different scenarios for these patients. So I've spent a lot of time with my occlusion design membership going through precision restorative records and bite record design for large restorative cases, because it's really a critical element to being able to finish these cases at the level of precision where you spend less than 10 minutes finalizing and adjusting the occlusion at insert. And the biggest tip I wanted to give you today is finish the case one arch at a time. I think it'll help you with your cases. And, you know, part of my rationale for doing these dental excellence videos is to give you some good, solid, foundational information that you can use in your practice, kind of tips. I'm trying to keep them short and give you one or two tips in each dental excellence video. And to be completely transparent, the other rationale behind me doing these series of videos is that you'll look at these and think, I really like learning from Dr. Stephen Phelan. I like what he has to say. I like the way he teaches, his teaching style. And I like learning online. You know, learning online is actually really cool, especially if you live and you're not in North America for sure, and you want to learn this material from somebody like me, but you don't want to travel to Toronto. So that's the beauty of an online continuing education community. And so I'm doing this partly to entice your interest in joining us with my occlusion design program. And it's currently closed. We're currently closed right now. The membership is currently closed. We just had a webinar promotion recently where we had a whole bunch of new members join the program, but currently we are closed, depending on when you're watching this video, of course. If you're watching this video the day or two after I filmed it, we're currently closed. So what I'd suggest is if you're interested in this kind of dentistry and you want to learn from me, you like my videos, click the link below this video. We'll have a link where you can join our waiting list for occlusion design. And we'll inform you next time we do either a promotional webinar or some form of promotion for new members. So join the waiting list below this, and we'll be happy to let you know when we have another opportunity to join my occlusion design membership. And what I'd like to do is finish by saying you can do this kind of dentistry. You can completely do this kind of dentistry. It can be complex. You know, there are a number of steps involved in treating these full mouth cases. But I believe that the systems that I've put together in my occlusion design membership makes it very predictable to treat these cases. So, you know, I believe that you can do this kind of dentistry. I also believe that beautiful dentistry with precise fit and occlusion is not just for the gurus. So thank you again for joining me with Dental Excellence, and we'll talk to you soon. Take care.